Caesar, it looks like we got Matt that asked the first question. What's up, guys? TikTok Live number 90. Top 5 listeners to listen. I'll be giving you guys a shout out in the caption of podcasts and YouTube. Thanks for coming on today, guys. The snowstorm happened, and I got a nice little beer here from St. James Brewery. This is the Deep Ascent. This is the Captain Pat's Porter. Their porter. Get this, it's St. James Brewery. One of the owners is a diver, and these are made on hops from like the Oregon 1880, I don't know, some ship that sank. So he went and dove down there, and they found yeast. They extracted yeast from old beer from their ships. So the ship that they dove and found. So so this is a beer made from back then. Anyway, let's get to the let's get going on the live. Thanks everyone for joining. Matt said, "Are you from Boston?" I'm trying to guess where your accent is from. I am not from Boston. I'm from Long Island. Would you rather like guess it instead of me telling you? All right, I'll say that for next time. But yeah, strong Island accent. Orlando said hi. Hi, Orlando. Who else we got? Pocket Smack 2005 joined. Pocket Smack 2005 said, "How do you deal with liberal patients?" What do you mean? I mean, I don't ask people's politics when I'm doing surgery. That has nothing to do with anything. Orlando said, "Where do you practice?" I'm on Long Island in New York, and I practice in Melville. Notification said I matched into OMFS. What's up, man? You got to get rid of this like blank and non-specific notification thing. Cheers, everyone. Hopefully everyone made it through the snowstorm, the blizzard of 2026. They're saying over 2 feet. It's the most snow they've ever recorded on Long Island since they started recording. Apparently, something like that in the Northeast. It's crazy. See, Benji. So yeah, notification. Let me know where you matched into OMFS. Congrats, by the way. And yeah, I did. This is it's the Blizzard episodes going on right now, so you gotta put in the Blizzard wear. See, Benji said, "Yo, what's up? I've been using Khan Academy for OChem, and it's been super helpful." What did I tell you? Khan Academy for organic chemistry is an excellent one. Good. Keep that going. See, Benji. Well done. Cam Wilson said, "Hey, I'm going into pre-dental. Undergrad is paid for, and I'm getting paid an extra $10K a year." Sweet. I wish everyone had that set up. Pumpkin Emoji said, "I DM'd you on Insta to intern for pre-dent map." Oh, I got to get back there. I'm so behind on the DMs on all the platforms. DMs, comments. I got to work on that. Thank you for DMing me. Would you help me to get the statistics of this year of your dental school? That's what we need to get. We need to get the stats of who matched at your dental school, how many people matched into each of the specialties. If you could get me that information, that would be a superb start. Orlando said, "I like Long Island." Where do you practice, Orlando? Notification match to UConn. Sweet, you matched to UConn. You're gonna know my boy Ian Lynn. I graduated dental school with Ian Lynn, and then you're gonna see Paul. I don't even know how to pronounce Paul's last name. It's like NJOKUI, Nwoki or something. Shout out to Paul. He's a good dude. He's a football player. He played football at UConn, and now then he went to UConn Dental School, and now he's at UConn OMFS program. So shout out to Paul as well. Oh, he interviewed you. No way. Ian interviewed you, presumably. Ian's higher up. He's PGY 5 now, I think, and then Paul's a 4? Paul's a 4, I believe. Yeah. Congrats, man. Congrats to matching to OMFS. Pumpkin Emoji said, "Yes, I can for sure help you with that. DM me when you get a chance." Yeah, I gotta get back to the DM. I gotta find all those. I'm so behind on this. I gotta catch up. I will. I'm working on that. Now that I finished the board exam, I can finally catch up. It's taken a while, but I'm working on it. Kim Wilson said, "I live in Kirksville, Minnesota, and Mosda, so Missouri something school of dental medicine is here. Should I try to go there or pub school?" I don't know what Mosdo is. Is that the dental school you're talking about? Dental and Oral Hygiene, School of Dental and Oral Health, Minnesota. Is that it? Is that what you're talking about? Cavalier Cartel, what did you splurge on when you finished residency? I went on vacations. With my fiance to London. We went to Cornwall as well. We went to London and then over to Cornwall, and then we went to Ireland as well for a couple of days. That was awesome. That was a great trip. Favorite beer? Let's see. My favorite beer for wintertime, I like a nice porter or a nice stout. I'm really liking Guinness's wintertime. Porter stouts are all great. And then for summertime, my favorite summer beer is the Kona Big Wave. That golden ale, that's a good one. And then let's see what else for For other times of year, let's see. I'm a big fan of Kolsch. I love Kolsch all year long. Kolsch's are great. Lagers are great. Pilsners are great. And then wintertime dark, like really wintertime. I like darker beers, porter stouts, and then summertime I like lighter beers, more towards like the ales, the pilsners and lagers, like the Kona Big Wave. Yeah, man. I also like Murphy's. That's a good one. Speaking of couple weeks, we have St. Patrick's Day coming up, so if you're having a lot of Guinness and a lot of Guinness and Murphy's. All right, let's keep it going. Orlando said Puerto Rico. Oh, nice. I was just in Puerto Rico for Bad Bunny's concert in September. I was in San Juan. Where are you at in Puerto Rico? Mike the Bike 1231 is specializing not worth it if your parent is a GP and ready to hand over their practice? No, not necessarily. You could still work in their practice as a specialist. Maybe you work there once a month, twice a month. You could still help on with ownership of that. You could learn the ownership. You could help them find other specialists to come in house. Absolutely. Yeah. So you can still specialize. I would just be very involved with them on the practice management side, the admin side. You know what I mean? Pumpkin emoji said, I'm on the wait list for my top dental school. Any advice? Call them. Make sure they received all your materials. You said you're on the wait list though. So that means that they likely did receive all the materials and they put you on the wait list rather than acceptance, right? I would call them. I would go there. I would say, make sure you can express to them that you're interested in going there. You know what I mean? Does that make sense? Yeah. You want to try and get off that waiting list, obviously, but it's using tricks like that to let them know that you're really interested in going there. Kim Wilson said, it's ATSU's dental school, like home of osteopathic medicine. Okay. It sounds pretty good. Yeah. What questions do you have about it? Abdullah said Endo versus OS, stuck between the two. Those are two. Endodontics and oral surgery are two very different specialties. I don't know how you could be stuck between them. What are you stuck on between them? One you're doing root canals all day, one you're doing surgery all day. It's what are you doing? Like, what year are you in dental school? You got to tell me where you are. I got to know. C. Benji said, do you remember the DM I sent you of what that surgeon told me? I was shocked he said that, man. So yeah, he was, C. Benji and sent me a DM saying that he was talking to an oral surgeon in Manhattan, and the oral surgeon said you have to be like a jerk or something. You have to be a douchebag or something to be an oral surgeon. And I'm like, that is absolutely wrong. That is so wrong. And it is wrong. That's incorrect. That's like, why would you say such a thing? That must be a much older surgeon who thinks that that's still the way of how surgeons were years ago, but it's not in today's day and age. And I don't think you ever had to really be like that. That was just like a stupid thing that people fell into. But yeah, that's not something that I align with at all. Thoughts on New York's new Yeshiva Dental School, 3-year fast-paced program? Yeah, I don't know. Well, I do know why everyone's opening more dental schools rather than working on dentistry these days. So for the last 5 to 10 years, we're in a consolidation period. Overall, in the industry of dentistry, there have been more offices closing rather than buying and expanding, okay? Partly because we're in a DSO era where DSOs buy a whole bunch of offices and they consolidate to just the practices they really need to run the business and profit a lot, and then they sell practices off to other organizations for a profit, right? So they're consolidating. We are in a consolidation phase. However, in the last several years, there have been 5 or more dental schools that have opened. So they're pumping out more dentists into a space that's contracting. That is the reason why they're doing that, is because in today's day and age, you make more money off of graduating dentists or more money off of CE courses, or however you want to look at it, right? Rather than actual dentistry of dental schools. The incentives should be, but the incentives are completely opposite. You make more money off of students paying via loans that they get from the bank than you can from insurance companies right now. So it incentivizes the dental student or dentist making money off of them rather than actually teaching students and getting a lot of patients in that need help and need care. And so that's where we're at. That's why that's going on. Yeah. So that is not good. Where are we right now? Where are we? Oh yeah. So Yeshiva Dental School, I don't think that makes any sense. You know how many dental schools there are in Manhattan? You have NYU, you have Toro right above there, you have Columbia on the Upper West, it's a lot of dental schools. It makes no sense to me. I'm sure that they've thought and figured out the business of all of that, but and now they're going to make it a 3-year fast-paced program. Do they really think they're going to start a dental school from scratch and make more money and make better dentists? I don't think so. I don't think they're going to be able to do that. But we will see. Cavalier Cartel, how long would you wait to splurge on a vehicle after residency? I'm still waiting. I'm renting my dad's car, and I would like to get the Cybertruck because it's safe, but I can't afford that yet. Just saving right now. just working on other things, other expenses, just saving. So how long would you wait to splurge on a vehicle? That might be a while. I mean, you're going to have other expenses that you need to focus on before you splurge, quote unquote, on anything. The most I would say I actually splurge on something like a toy, it was a very old Omega that I found on a website from Italy, and it's an Omega watch from the 1940s. Um, so it's like over 80 years old, and I got that watch for under $1,000 with shipping and everything. It might have been like 1,100, but I got it for like 950, which is crazy, and it's authentic. I brought it to Omega and everything, got it verified, and yeah, so like that is that really a splurge? Like a $950, it came out to 1,100. I don't know. Maybe I guess you could call that splurging. Sure. But otherwise, everything else would be going towards bills, expenses, gifts, just saving for stuff. The house, I'm starting to pay off the house now. My house that I grew up in. My dad's passing on to me, so I had to get a mortgage and open that out and go from there. So anyway, how long would I wait? You really need to work on self-awareness to figure out what your situation. Can you buy a car right now? You know what I mean? That's what the question you're going to be asking you. And sure, it's going to be like, yeah, you can, but maybe you should probably start paying off your loans a little bit. Get a good dent in your loans first. Maybe you want to work on saving up for ownership in the practice or partnership in the practice or a practice or your apartment. Thinking about buying or something. I think those are, real estates are a great idea if you have other bases covered. So I don't know about splurging. I don't know about splurging just yet. If you're just starting out, you still don't have money, right? Because you didn't make money in residency. You didn't. Like, it's negligible. So yeah, lots to go in on that topic. Cavalier, rather than me rant more on it, what other questions do you have about that? You know what I mean? Orlando. Another thing is, if you are going to quote unquote splurge, the one thing that my fiance and I talk about is if you're going to buy a car, a watch, or something, it would be nice if you're not taking the money that you made and saved with and buy it. No, you should take the money that you made and saved with, put that into some investment, and that the money that the investment creates for you, that should be the one buying your car or your Rolex or Audemars watch. Just my thoughts. That's my goal. Orlando said, Veja Baja, half hour from San Juan. Wait, so you're really close. I bet I was in that area because we traveled to the school to pick up my fiance's nephew. I don't remember the name of the town or the area, but it was 30 minutes outside of San Juan. So I bet I was in that area that you're in. You probably know them. That's all. Santiago said, I work for All County as an assistant. I hope to see you in the future. Santiago, what's going on? Which office are you in? Where did I see you at the holiday party? Santiago, I must have met you, no? Pumpkin emoji said would be down to run the OMFS rotations for Yeshiva Dental. Would I be down to run the OMFS rotations for Yeshiva Dental? What do you mean? How would I run their OMFS rotations? I can set you up with the dean new. Well, like, are they gonna pay money for someone to run OMFS rotations? Sure, like get me more information on it, but like I gotta see if I can actually make a living, doing that because I need to make a living right now, pay off the house, the bills, start a family, Owen said at pumpkin emoji, also give them updates on what you've done since interview day. It shows you're improving. Yeah. Hey, that's a great idea, Owen, to give the school updates on what you've done since the interview. And also you don't want to like brag, but you want to show them interest. You want to show them the utmost interest and eagerness in getting accepted to that dental school. Abdullah said, D1, I don't know much yet, but I've had shadowed both and lifestyles seem very enticing. What made you choose oral surgery? Well, I chose oral surgery. Yeah, both lifestyles between endo and oral surgery are great. I chose oral surgery because my interests in dentistry and surgical dentistry were geared more towards that. So that's why, like, I was not going to go into doing root canals every day, but exploring surgical procedures was 100% of my interest. You know what I mean? I wasn't going to be doing removable dentures either every day. So yeah, I went the oral surgery direction. I was not going to be, doing this with the teeth all day. Derek said, you ever share a spaghetti noodle with the homie for profit? What? I don't get it. Alex said, do you think it's beneficial to do an accelerated pathway to dental school? Yeah, I mean, anything accelerated is generally, sure, it might be more competitive, but anything accelerated is generally great, right? Orlando said, we got 2 more schools in Puerto Rico. Oh, you have 2 more dental schools that opened up in Puerto Rico. Isn't that interesting? There are more and more schools opening, but even Puerto Rico, we're in a consolidation phase. Isn't that crazy? Bill Beard said politicians are stockholders. Yep, that sounds about right. Nick Jarbow said, sup, brother. I just took the DAT Saturday. How'd you do, man? Congrats. So you finished with it. You just took it. Today's Monday. You just took it 2 days ago. You should be having one of these. Cheers. Congrats. Pumpkin emoji said, so, oh, man, that is delicious. Once again, this is the Captain Pat's Pirates, a porter from St. James Brewery here in Smithtown. Great beer. Great beer. It's delicious. Pumpkin emoji said, sorry for a stupid question. Why would anyone specialize if there's CE courses? Yeah, but what is a CE course? CE course is a weekend or a long weekend or a week tops where they teach you procedures and stuff. You might be doing practice on mannequins or, plastic teeth and not on real patients generally. And you might get a certification, but it doesn't necessarily mean you could do those procedures safely. It doesn't necessarily, just because you get an IV sedation certificate in Ohio doesn't mean that you're doing a safe IV sedation and can manage all complications that can come up and will come up with IV sedation. You see what I'm saying? Just my take on it. If you can't handle the complications of any procedure, you should not be doing them. And specialists have years in those areas of those specialties and therefore are trained to manage because they've managed it many times. Just my thoughts. But hey, if you can manage all those complications, then yeah, you might be qualified to do them if you're experienced with them. So there's a lot to go into on that topic, right? But yeah, we'll see. We'll see if the ADA will enforce that. But it's tough because the ADA is definitely they're turning a blind eye to a lot of the DSO expansion and all their tactics and stuff. It's not necessarily better for dentistry, but the ADA is turning a blind eye to it. And another thing is because they pay the ADA and the politics behind allowing them to expand. And that's why they do turn a blind eye to it, right? Because they're lining their pockets with certain things. So that's something to consider. And then that's why these CE courses aren't being shut down. That's why they're not being shot down and shunned. They're being, because it's an easier way for DSOs to just pick up recently graduated general dentists, send them to CE courses and have them to cover their like quote unquote higher level surgical procedures and specialist procedures. But it doesn't necessarily mean that it's better patient care. Something to consider. There's a lot going on with these things and moving targets, right? Matt 30, but yeah, a pumpkin emoji. Does that make sense? I just threw a lot of information in here. You know what I mean? That's what's going on. This is exactly what's going on. And there's the pathway of why there's a blind eye being turned, why the politics are ruling it all. And okay, it's because, the DSOs, they have all the money and the power and the litigation, and it's beneficial for them. They could save money if they could just take young, naive dentists with a lot of debt, send them to CE, and then to do these higher level procedures. However, you got to remember, it's not better patient care. That's not better patient care. Matt 34, quick question. Matt 34 say, quick question. How would I know my bottom wisdom teeth are close to the nerve in the jaw? X-rays. CBCT X-ray is a three-dimensional X-ray that'll show you exactly where that nerve is in respect to the roots of your lower wisdom teeth. All right. Very good idea to get those before you have your wisdom teeth removed. Right. Many times the Panorex, that's a two-dimensional X-ray, will show where the nerve is, but if they look close or overlapping, generally a good idea to get that CBCT so you can see exactly where it is, and the surgeon should know exactly where it is to avoid that nerve. Right. Matt 34 said, I have a consultation tomorrow. Just want to know what to look for. Yeah. So the Panorex is a good scouting film. So you get to see the general, both jaws for the most part. You get to see some pathology, some larger cavities, and ultimately where, the TMJ, and then ultimately where that nerve is in respect to those root tips. If it's close, get a CBCT. All right. Emoji said, I make custom watches. I'm going to DM you if you want to get one. Get one. How about you make custom watches? No way. Yeah, let's do it. I would love. This is Filippo already moon phase. I would love to collaborate a watch with you, man. Can we do that? I'm so down. Send me a DM. Send me a DM on Instagram. Can you send me a DM on Instagram? Because I would love to make a custom made watch. I got an idea. I want to get a date diver with a moon phase on it. That's my dream watch. I don't know if they're a Breguet watch has that, but otherwise I haven't seen any other ones with that. So that's what I would want to make with you. Wouldn't that be sweet? Bill Beard said, doctors are terrible these days. I disagree with that. You got to find the right doctor for you. That's the answer. Nicholas Cheatham said, do you agree that dentistry is a bad path if you're in it for the money? I believe any career path is bad if you're in it for the money. Yep. You could even be like a businessman. If you're in it for the money, you might make a lot of money, but you might ruin a lot of people's lives with it because your values aren't balanced with purpose. Pumpkin emoji said, how much is the average starting salary on Long Island OMFS after residency? Gosh, it varies very widely. And yeah, Long Island, and it's going to vary throughout the United States. So I know you said Long Island for oral surgery, but it's going to be it's different from everywhere else. It's really different. Orgies just said, hey, I literally just saw your apartment video, LOL. That's so funny. What'd you think? What'd you think of it? That was a real video. That wasn't like planned or whatever. That was literally all in the moment. I came home and then I went right back because I was on call that night. That sucked. Thinking I'm not calling like that anymore. No way. That sucks. Momo Guapo said, I got an infection from a bad root canal. Should I get another one or just pull the tooth? So the same tooth you need? I don't know. It depends. I can't tell you that answer. Sometimes if you just get the root canal redone, that can do the trick. Many times you can get the root canal done again, but it doesn't mean that it's going to fix everything. Even the apicoectomies, you can get the apicoectomy, meaning you remove the tip of the root of that tooth, which is generally thought to be, if it's a smaller chronic infection and it persists after root canal treatment, that's why you do the apicoectomy. But the prevalence, how often that works, it's so variable. It depends on a lot of things. It depends on the size of the infection, how well the root canal was done. There's so many things. So I can't give you the answer. You know what I mean? Mo2Man4 said, after a 4-year OMFS program, can I get into rhinoplasty? Yeah, you can do that. I know Rutgers, even their 4-year residents, Rutgers, they do a lot of rhinoplasties in their clinic even. Yeah, they're doing it. Maybe under sedation as well. I don't know. But I know that they're doing a lot of rhinoplasties over there in Rutgers. But yeah, you could do that as a 4-year. Sue Goy said, do you do zygomatic implants? I haven't done many in a while, but yeah, I do them. Yeah, I can do zygomatic implants. I would like to explore options such as, All-in-X implants first, as well as posterior, sinus lifts in the posterior to see, and then maybe pterygoid implants before we go zygomatic. But yeah, there are options, many options. Victor Electric said, should I feel bad for having to redo my first semester of D1 because I couldn't deal with the stress? No. Everyone's situation is different, Victor. You shouldn't feel bad about anything like that. Now, you should be very self-aware and think about how you're going to crush it this year of D1 coming up, right? No regrets. Go full steam ahead. Think about what went wrong, what caused the stress, and get ahead of that so you don't have the same level of stress, okay? I want to see you succeed, Victor. Let me know how that goes. All right, you got this, and good luck this year. Altman said, sir, can I ask for an unbiased advice? Absolutely, Altman. HUD said, I've heard Endo is slowly becoming more comp than OMFS. I don't think so. I haven't heard about that. That makes no sense. Who'd you hear that from, and what was the comp? What was different about it? So Altman said, sir, can I ask you for an unbiased advice? As a dentist, would you be shocked if someone under 30 was worth $5 million liquid? Be honest. Yeah, I would be shocked. I would be shocked if someone under 30, you mean a dentist worth $5 million under 30? Yeah, I'd be shocked. Victor Electric filed the live creator. Thanks, Victor. Thanks, man. Owen said, most competitive OMFS residencies, they're all really, really competitive. And it's crazy because things shift. Some competitive residencies like Case Western, but 2 years ago, they had 2 unmatched spots. Like some programs where you think are competitive, they may rank their applicants a little bit differently, and all of a sudden they don't seem as competitive based on the results and the data, the results statistics, but they are very competitive. Altman said, how much are dentists usually worth by age 40 and 50? Are they incorporated? I don't know. That's so variable. And that's also like where does that question come from? You know what I mean? That's just a comparison question. I got to be honest, that is such a terrible question. You know what I mean? Because that's completely financial driven. That's solely looking at the money in someone's net worth by their age. It's like you're trying to calculate someone that based on their age and how much you're worth. Maybe my mind's on the gutter, but I just feel like that question isn't coming from a good area. You know what I mean? So yeah. Oh, Altman said, I'm honestly curious. Fair enough. Yeah, it's good to be curious, but it's like, who do you have in mind that you're being curious about? Or is that what you're looking to go into dentistry for? Do you want to hit a certain number by a certain age? I don't think that's. Oh, there you go. Yes, I'm trying. Altman said, yes, I'm trying to figure out the net worth out of someone whom I know. You're either, but then what if you find out? Then you're gonna either look at them you're gonna look at them in a different way. That's, you know what I mean? So first of all, I couldn't even give you the answer because things are so variable based on state. Is it an insurance-based practice? How many days a week do they, you know what I'm saying? But Altman said, they said they're worth $5 million by age 21. No kidding. All right. That's ridiculous. And I don't know about if they're your friend even. John Goodman. What's up, Dr. Goodman? How we doing? John Goodman, DDS said, as a restorative dentist, avoid cantilevers as much as possible for AOX. AOX is the all-in-X surgery. Dr. Goodman, excellent advice there. Yeah, you got to avoid the candy levers. That's a very great point. Dr. Goodman, thank you for that. Dr. Goodman, where do you practice? Are you in the New York area? Where are you? Let me know. Let me know what you're doing. Do you do a lot of restorative dentistry with all in X's? I'm curious. Owen gave the skull emoji. Altman gave the laughing emoji. Altman said, "I think they were stealing gold tooths out of people's mouths." Dr. Goodman said, "Kansas City. Oh, you're a ways away. Kansas City's got some good stuff going on, especially in dentistry, right?" I've been hearing a lot of good things around that area in Kansas City. I've been hearing really good things about Tennessee, North Carolina, Kentucky for dentistry. Yeah, very good areas. I made an oral surgery friend at one of the boards courses I went to, Chet, and he works 4 days a week in Knoxville, Tennessee, and he's got a good setup. He's on a partnership track or going to be owner. He's got like 3 or 4 kids. Really good dude. But all right, what question? What other questions? What other questions, guys? Let's keep going, friends. What question is going to help you with? Did everyone have a good snowstorm? Is everyone alive? Everyone's okay? Happy Monday. Happy snowstorm. And by the way, this is TikTok Live number 90. I've done 90 now. We've done 90 now since we're a team. And yeah, TikTok Live number 90. So the top 5 listeners who stay on for this, I give you guys a shout out in the caption of YouTube and podcasts in the full length version. Dr. Goodman, Dr. John Goodman, DDS. We have a lot of young and talented OMFS, fun to work with and keep me learning. Yeah, we learn from you too. We learn from you too, Dr. Goodman. It's a great partnership experience. How do you refer out, Dr. Goodman, or do you have an oral surgeon come to your practice? What's your setup? Do you take a lot of insurances? Are you fee for service? I'm curious what you got going on. Naomi joined. What's going on, Naomi? Dr. John Goodman, he got the #1 viewer badge. Wow, you might be #1, Dr. Goodman, on the watch. On the top 5 listeners who watch. What other questions we got? Vadim liked the live. Vadim just got the #2 viewer badge. Oh, there we go. So I was talking to a dentist the other day, and he said that he was talking about an oral surgery practice, and he was like, the 2 owners of that oral surgery practice are 2 completely different people. And he was talking about one of the guys he'd like to work with. Turns out that's Dr. Orentlicker, who trained me especially in implant dentistry in my oral surgery residency at NYU Bellevue. He was at the VA though. And he was, oh man, so important on my implant training there. And it was funny because that was the oral surgeon that the general dentist I was just talking to the other day who was talking about. And lo and behold, this is actually a watch that he had that I ended up buying too after my rotation with him and learning with him. So I don't know, just funny how things are all coming together. Maybe it's just my ADD mind going all over different directions. But yeah, this is a watch that I ended up buying because he had it. And I don't know, I love it for the mood phase and how simple it is. But yeah, anyway. All right, friends, what's next? What questions can I help you with? What do we got going on here? Mohammed Cole joined. What's going on, Mohammed? 01 now. Here we go. Alexis, Perez, Cadena. What's up, Alexis? How you doing? I believe you were in the top 5, one of the last 2 TikTok lives. You were in the top 5, right? Alexis Perez Sedana said, "What are your thoughts on doing procedures and providing sedation at the same time?" I do it all day, every day. We do it. Yep. It's a very safe and reliable method. There's an art to the sedation, right? Because there's a balance in between making sure a patient is comfortable and in between, going apneic. Apneic is when they stop breathing, right? So you don't want that to happen, obviously. But all you need is someone just to be a touch asleep. That's all you need. And then you need to give them a little bit of medications as needed through the procedure. They're fine. They're breathing on their own. They're comfortable. Sometimes they're light enough where they can even respond to directions like turn left, turn right, take a deep breath, things like that. But they're fine for the surgery. They're comfortable. They're not moving. They're relaxed. That's what the IV sedation is all about. And there's a beautiful, delicate balance to that. You know what I mean? So my thoughts are it's safe, it's reliable. If you have sufficient training, it's great. It's good for you. It's good for patients. It gives another level of anti-anxiety to the dentist's office. Everyone's got anxiety in the dentist's office these days. So it helps to have that skill under your belt to help patients out. And it is very safe. I mean, you don't want to zonk anyone. You don't want to be doing IV sedations on very, very old patients or with a lot of comorbidities or what have you. ASA 3 or 4, I don't do sedations on them. I'm only doing sedations on ASA 1 or 2. So things like that, you know what I mean? Very rarely will I do a sedation over someone over 65 years old. I try to stay away from that. I try and stay under 55. And so just things. Shady Azar said, if you only got accepted to private dental school, would you attend or reapply? Great question. It would depend on what private dental school that was, right? If it was NYU, I don't know. I don't know. I don't have a yes or no for that. If it was Columbia, I would go. If it was Harvard, I would go. You know what I mean? But yeah, I went to Stony Brook Dental School and everything was great there. The class sizes were small, so you got more clinical attention. The tuition was great for state school. Excellent specialty match. They match a outstanding number. The ratio of students they have in a class is small, but the amount of people they match into specialties, it is a very high ratio compared to other programs. So Stony Brook Dental School is a really good idea for going into specialties from there. Cody said, how important to you are ergonomics in dentistry? My dad retired early from dentistry due to injury. Oh, dude, the back has been, and I'm like a very active person. I eat very healthy. I stretch, so many different things, and yeah, ergonomics are so important in dentistry. I mean, think about it. You're constantly taking out teeth. Half the teeth I'm taking out every day are on the top jaw, and you got to be looking upside down. You're not just looking down, straight down at the lower jaw all the time. So yeah, ergonomics are extremely important. Yeah, and my back is sore as heck right now. Hassan said, most random or most difficult dental interview question you got? Random one, I would say, was from Montefiore, and it was, what's your biggest life regret? But I didn't have a good answer for that. I don't know. Let's see. Goober. What's up, Goober? Goober said, do you know much about differences between UF Jax and Gainesville? I'm sorry, I don't. I don't know. I don't know the differences between those two. Alexis Perez Sedana said, I heard some talk online of some medical anesthesiologists not liking OS model of doing both. No, nobody in other specialties likes the OS model doing both. Why? Because none of the other people in other specialties, medical anesthesiologists, pediatric, no one else can do that. So of course they're not going to like it, right? Does that make sense? They're constantly bad mouthing oral surgery for doing both of the procedures. But the fact of the matter is, so many few people could get dental care or surgery, teeth removed, if you took away sedation. And they're not talking enough about that. Yeah, the pediatrics and medical side, the anesthesiologists, CRNAs too, because that's the CRNA job, basically, is you have a lot of dentists hiring out CRNAs and dental anesthesiologists. And so that would really not be good if they, but then think of the cost of a procedure to have a couple crown splits or filling done or have a tooth removed if you have to have the provider and the anesthesia specialist behind. Could you imagine how much that's going to cost? I mean, anesthesiologists, they bill out like $1,000 an hour. So you automatically already have, like, to do a couple crowns of filling, you're already booking. Now multiply that, add on another $1,000. And that doesn't even include other staff, materials, sedation meds and stuff. So the cost of everything's about to go up even more if they were to separate anesthesia from oral surgeons. You know what I mean? But it's a political thing. It's all politics. That's where that's coming from. You know? T said, did you ever have a toxic attending? Yeah. Oh yeah, I had a lot of toxic attendings. Is that even a question? A lot of places have toxic attendings, and I had a couple really toxic attendings. One was like, oh man, yeah, yep. So yes, the answer is yes, and a lot of places do, and it makes your residency experience extremely difficult and grueling and full of anxiety and stress and pressure that's unnecessary when you're learning how to do surgery on people's face, you know? Oh, in February, CBSE scores release got delayed a week because of President's Day going on week 2. You know, when I took the CBSE, they weren't released for like a month after. So 2 weeks isn't that bad. You got this. You got this. Just relax, Owen. You got this. All right, a couple more questions then. Noor joined. What's up, Noor? TikTok Live number 90, top 5 listeners. I'm going to be giving you guys a shout out in the caption on podcast and YouTube. Owen said a month is crazy. It is crazy. Yeah, you're just sitting on the edge of your seat for a month. T said, so if you saw a certain attending on your rotation, you automatically get anxiety? Yeah, I would try and like run away. I would avoid. I would try and, try to avoid as much as possible, just because no conversation was ever going to go good with that attending. Does that make sense? Like, ever. Everything that came out of your mouth is stupid. Everything that you say is either illegible, they couldn't hear you, or makes no sense, right? It was like that kind of thing. Yeah. Oh yeah. T said, that's tough, LOL. Yeah, it's very tough. When there was a point where my off-service rotations, talking about like bariatrics, SICU, MICU, the ICU rotations, all these other rotations, when you're having a better time on your medicine rotation, when you're having a general surgery rotations, when you're having a better time on those off-service rotations than you are on your service, solely because of the social factor of toxic attendings, yeah, that's a problem. that's a big problem. But that's how it goes sometimes. Sue Sue Joy joined. What's up, Sue Joy? Valor and Super joined. What's going on? What do we got, friends? What else? I'll say it one more time. TikTok Live number 90. Top 5 listeners. I'm giving you guys a shout out in the caption of YouTube and podcast, the full length recording. Okay. $$ said, do you have any advice regarding program selection for externships? Yeah. Select reach programs. Okay. So you're going to be asking like dental students that you go to school with, right? And you're going to be asking them where you should do externships, where do they get interviews and stuff. Aim for really good name programs who, like, it's going to look good on your resume throughout the country, and maybe programs that you don't expect to get an interview at. The reason being is you go there, you get a good experience, you get to learn what the program's like, they get to learn what you're like, and if they like you, you might have just gotten yourself an interview at a program you didn't expect. 2, if you don't get an interview, fine, you didn't expect to get it, but that name goes on your resume that you did an externship there, and when you apply to all the programs, it's going to look outstanding. You see what I'm saying? So that's the strategy you should think about when you're applying for externships and looking for programs to externship out. Okay. Sue Goy said, have you done a reconstruction of the jaw with a tibial graft before? I haven't with the tibial graft. Nope. Hidden Loop said, what's your number on extraction tip? What do you mean? What's your number on extraction tip? What does that mean? Hidden Loop said, what's your number 1 extraction tip? Sure. My number 1 extraction tip, I would say, is maybe really focus on learning what the Panorex can show. Sometimes they're like, take a look at that Panorex and get an idea of what ankylosis looks like. So next time there's an ankylosed tooth, the roots, and there's minimal or no lamina dura visible at all, and you're predicting, okay, it's ankylosed. Now you're going in there knowing from square one what you're going to have to section that tooth, or maybe you're going to need to use a couple more elevators, a little bit more luxation, gaining mobility. That's one thing that's important. Another thing that's important with extractions are know your instruments. Try new instruments on easier teeth, but hard teeth, always go to your go-to instruments, okay? If something's not working, you usually have to change it up. CBCTs are very important when you're around the nerve. I can't stress the nerve or other roots. Very important. I can't stress that enough, especially around those nerves. For extraction tips, yeah, we'll have to go into that though. Angie Garcia said, tips for sleepless nights from tons of call for OMFS residency, please and thank you. Ooh, yeah, that's a tough. Are you exercising regularly? I think the biggest thing for me was exercising regularly. I know it's so hard in residency, Angie. I know, but if you can keep up with a decent exercise routine, eating healthy too. Want to make sure that your diet is good and you're on top of the game there. But a good exercise routine, I think, is great. Also, when you're off on weekends, get away from the hospital area. Just go home, go with your significant other, just get out of that area. And it's so important to kind of change of scenery, change of pace, just go and get yourself away and relax. Okay. And then when you go back to work, it's go time. It's go back to work, but then you'll train your body to like when to relax, when to be focused. Okay. Hi Simpson said, hi, RDH from North Carolina. Hey, I was just there for the board's exam on February 3rd. I was in Raleigh, North Carolina, and then I was in Charlotte for the board's course back in October. John Goodman, DDS, said, are you still taking trauma call at any hospitals? As of right now, I'm not, and I was exploring getting credentials there, but they don't pay oral surgeons to do any work there, and you're not getting any money if you work there. So that just doesn't make sense to me. I'd be happy to do trauma call, facial lacerations, mandible fractures. I'd be happy to do it, but you got to compensate surgeons for surgery. You know what I mean? They're not doing that on Long Island. So yeah, that's something. Isn't that a shame? You know what I mean? You have surgeons on Long Island not working on it because they don't pay them. But why aren't they paying? Makes no sense. Cody, why did you choose OMFS? Other specialties? Well, if you look at all the other specialties, pediatrics, I see plenty of kids in oral surgery. I can't only be seeing kids all day. That would be tough. That would be very tough. And some people can do it. You know what I mean? I do surgery all day. I see blood. I cut into the gums. I cut into people all day. That's me, Prosthodontist, great specialty. But then the removable side of prosthodontist, no, get me away from that. Endodontics, you're only doing root canals all day, which is crazy because now in their residency, they're trying to have endodontists doing implants. Can't be doing that. You're literally periodontics and endodontics. They were created to save teeth, and now they're doing implants. Tell me that one. That just doesn't make sense to me. What else we got? Dental anesthesiologists, they do a great job, but I don't know what the job market is for them. You know what I mean? What else we got? Yeah, so general dentistry. I like general dentistry a lot. Yeah, if not OMFS, I probably would have gone general dentistry and try to hone in on ownership and surgical procedures. That's probably what I would have done otherwise. But all right, friends. Last question. Whoever put one more question in the chat, and then we'll wrap it up. Mike the Bike 1231 join. What's up, Mike? Mike's back. Mike's back. One more question, friends. What can I help you with? Is there a way so I can see who's watching right now? Alexis Perez is on. Dr. Goodman's on. Dr. Goodman, how you doing? Do you hire out? Do you refer out, or do you have an oral surgeon come into your practice? Jones said, "Are you full scope?" The residency program I was at is full scope. At this time, my practice is not full scope yet. Dr. Goodman said, "I refer out." Okay, you refer out. Would it be beneficial for you if you kept the surgical procedures in house? I'm curious. If you had an oral surgeon that knew how to make that work, would that work for you? Are you a fee for service practice? Do you take insurances? If you take insurances, do you take all insurances? I'm curious. I'm trying to learn. Just trying to learn. Kimmy, DDS PhD student. What do you think is a common mistake new general dentists makes regarding OS cases? I think perhaps some general dentists underestimate kind of what goes into oral surgery and surgical cases and patient comfort and IV sedation and the monitors and even just the surgical assistants. The experience that a surgical assistant has on those, it would be like, imagine taking a surgical assistant to someone to assist a cleaning or assist restorative dentistry. It would take them a while to learn and get used to it. You know what I mean? It's just different. And I think that makes sense. But I think sometimes maybe general dentists overestimate or underestimate what goes into that. And, and I'm not saying I underestimate what goes into general dentistry. I'm just saying it's different. You know what I mean? You can't judge something else that you haven't done before because you don't have the experience. You don't have enough exposure or insight to that area. So I would never over or underestimate someone else's, day-to-day or job or something. I think that's really important. I think that's a really important lesson that we all could work on. You know what I mean? Dr. Goodman said, "We are a network with 3 plans. Honestly, for me, it's no issue to send patients out for OS or Endo." Just 3 plans. That's a really good setup you got there, Dr. Goodman. You're in network with just 3 plans, man, because we're taking almost all Medicaid right now, and it's a lot. It's a lot. So, Dr. Goodman, it sounds like you got a really good system going there. If you refer out OS or Endo and it comes back and you're happy with them, that's awesome. Another thing, a story here is general dentists, they send out to a specialist or to an office of specialists, and then they get back different work every time. Or, so my goal is to make general dentists' lives easier for the restorative or whatever it is that we're collaborating cases with, partnering on cases with. And I know sometimes it can be difficult that way. Kimmy, follow the live creator. Thanks, Kimmy. Joe Martinez says, "What's your favorite beer, Doc?" I was saying I like more darker beers like stouts and porters in the wintertime, and then lighter beers. We're looking like pilsners and ales in the summer, and then lagers really all year long. But I would go with Kona Big Wave for summer beers. I don't like to have Kona in the winter though. And then wintertime, a porter, a brown ale, a Guinness, something like that. Murphy's. I've got some darker beers tonight. I did. This is Captain Pat's Porter from St. James Brewery. So shout out St. James Brewery in Smithtown. And then another shout out to Spider Bite. This is the Bite-nator. It's a double bock. It's an 8% beer. I'm going to have this little shower beer. Yeah. It's a day off. You got to celebrate once in a while. You know what I mean? I didn't drink for over a month before the board exam on February 3rd. So a day off here, can relax a little bit. We're hanging out. We're doing the TikTok live. What are we up to? Mike the Bike 1231. In how many years are you planning on building your own practice? Oh, I don't know. I got a ways to save before we get there. I got a long ways to go. I've got to save up for the wedding first. That's next. While paying for the house, I need to save up to get a car. I need to get my own car. That would be nice. Yeah, and then we'll see. We'll see where we go from there. We got to see. But my goal would be to, as an owner, would be a partnership, not a sole owner. Like, you know what I mean? I like partners. I like a team atmosphere. That's fun. That's fun to be a part of a team. Dr. Goodman said, 32 years, and I wish I was fee for service. 32 years, Dr. Goodman. You've been in it 32 years. But you've gone a long way. Now you're only taking 3 insurances. I mean, that's a win. Of course, everyone wishes that you could be fee for service, but It depends on your area, right? It depends on your marketing. There's so many different factors. 32 years, that's a long time, Dr. Goodman. Yeah. I Simpson said, what do you think about general dentists doing implants? Yeah, I mean, people can do implants. I think that could be just fine. It really depends on what the case is. You know what I mean? And there's a lot that goes into it. Mike the Bike 1231, still thinking of getting the Cybertruck? Yeah, I really do want to get the Cybertruck. I think it's a safe vehicle. It's electric, so it's better for the environment if you have it more than 2 years, right? Because the 2 years is that lithium battery to make up for, I guess, pollution that goes into the battery. I've looked into that. But if you have the car more than 2 years, then it makes up for that or more. I think it's like it really comes out to like a year and a half, but I'm just saying 2 years to overestimate. So it's electric. It's good for the environment, and the Cybertruck is safe. It's a safe vehicle. I want to have kids one day, so I want them to be safe. I'm not overthinking it. It's really just safety. You know what I mean? Because driving a car is dangerous. Like it's more dangerous than flying on an airplane for sure. You know. Shout out to Spiderbite, one of my favorite breweries on Long Island. Started going there in residency, first year residency. Yeah, good memories there. This is delicious. The Bite Nader double lock. All right, friends, what do we got? Jad's version join. What's up, Jad's version? We're at 15 minutes. 50. We're at 50 minutes now, so I might sign off soon. What are the questions can I answer? A couple more, and I'll get going. Cheers, friends. We survived the snowstorm. That's good. Joe Martinez said, what would you say to an undergrad to convince them dentistry over medicine? You shouldn't have to convince anyone to do anything. You know what I mean? You should answer their questions. They're probably going to have an idea of whether they're going to go with something or not. Answer the questions from trying to be unbiased, or unless they ask you for your perspective on something, just answer questions from an unbiased perspective. This is what I do with mentoring all day long, right? I'm not trying to convince anyone to do dentistry over medicine. I would just say you need to get more exposure to both. And then which one do you see? Which one aligns more with what you're interested in, what you want to be doing in the future? That's it. It's pretty simple. Pretty simple. So I think that's a good last question to wrap it up on. Thanks, Joe. Thanks, Joe Martinez. Mike V joined. Sarah joined. All right, friends. So today is end of February, and this is TikTok Live number 90. Top 5 listeners, I'm giving you guys a shout out in the caption of the full-length recording when I post it on YouTube and podcast. And guys, thanks for coming. Thanks for being part of this project. I really appreciate it. Hope you guys enjoyed it. And the show, this episode. And Dr. Goodman said, stay safe and have a great night, Doc. You too, Dr. Goodman. And congrats with your practice and everything. All right. Joe Martinez said, thanks, Doc. You got it, guys. All right. Signing off. I'll be putting you guys in the caption, and have a good night. All right. Stay safe out there in the snow.